So Cheryl, there's a lot for employers to try to prioritise when it comes to benefits. What type of challenges are employers facing in the year ahead? And are they likely to change in the next 2 or 3 years or stay relatively the same?
So in the year ahead, I think the employers are going to continue to have to answer that question around benefit equity for all. It's a challenge that some have already tackled. It's one that some are yet to, and some will still need to tackle in the future, particularly when we're considering healthcare. And when you consider the fact that there are rising costs within the healthcare, especially in the private medical insurance space, and that we don't see a tail off of those in the medium term, they're going to continue to be those challenges that they're facing over how do I provide something meaningful, not just in healthcare, but across all benefit provision for all, but something that's sustainable for the future. And that's our role, is to help them navigate that landscape.
And with rising healthcare costs, how will employers justify the expense to cover employees maybe for the first time? And do you predict fewer employers will take that plunge?
I think what you would hear me talk a lot about is data and insight. We're increasingly moving and changing the narrative from benefits as a means to recruit and retain individuals to what we often talk about in terms of people risk. So actually, if we think about, people, the ability to recruit them, retain them, but actually presenteeism, productivity, absenteeism, all of those actually are a risk associated with a business ability to perform and to grow. So if we look at it through that lens, and then we're able to understand what are the factors that are going to make a meaningful difference to that, I think healthcare plays a big role within that in the current climate. While we have the NHS where it is, healthcare and wider benefits. I mean, we've not talked about financial well-being. We've not talked about, good pension outcomes, which will have an indirect impact on the cost of healthcare in the future if the workforce ages, and therefore we still continue to provide PMI to an older demographic. All those things come into play. But ultimately, if we look at it through a people risk lens, and we can help employers understand what those costs are today, but what those future costs may look like if these things aren't invested in and tackled today.
And with all these challenges for employers to face and a lot to think about, what are the main tips you would offer employers trying to control their costs in health cover?
You've got to understand what it is that you're trying to achieve. Historically, in our world, people provided benefits for 2 reasons: to recruit and retain. And actually, we didn't do a lot of data analysis to really even understand if it achieved those objectives. It was more around benchmarking. We're in a very different climate today. So we have to understand, why are we providing this, and ask ourselves some serious questions. Only then can you ensure that you're doing the right things to achieve those objectives. And data and insight is key in that. Not just looking at the data, but really understanding what are the 5 things that that's telling me, and my 5 things that I need to action. So good governance around your program is really important.